episode, we are going to be talking about PCOS, what causes it, the things you can do to reverse it, and why it is very critical that you do something today to reverse PCOS. Polycystic ovarian syndrome is a condition with multiple and varying symptoms. How it affects Miss Tonia might differ from how it affects Miss Onyinyechuku. And it is a very common hormonal condition affecting 1 in 10 women. What happens in PCOS? In PCOS, there is a dysfunction or abnormal release of gonadotropin releasing hormone. Gonadotropin releasing hormone is a hormone that stimulates the release of follicle stimulating hormone and luteinizing hormone, FSH and LH. And it causes more LH to get released and low levels of FSH to be released. What is the role of these hormones? FSH especially helps the ovary to release follicles, just like the name implies. It stimulates the ovary to release follicles and helps these follicles to mature into egg that can be fertilized by a sperm cell. And every month, a normal woman releases 6 to 20 follicles, and one out of these follicles matures into an egg which is released during ovulation. But in women with PCOS, because of low levels of FSH, these follicles do not mature, but rather they form cysts due to their failure to mature, and these cysts deposit on the ovary, leading to multiple ovarian cysts within the ovary. That's where the condition got the name polycystic ovarian syndrome. High levels of luteinizing hormones released in PCOS women is a big problem because it causes the ovary to secrete androgen. And normally, a woman ought to secrete androgen known as male sex hormone in very small amounts. But in PCOS, because of high levels of LH, these androgens are secreted in very high amounts, leading to growing hair on unpleasant places like the face, the chest, and having hairy body. High androgen level causes reduced production of estrogen, which is also an issue on its own because estrogen is very important in egg maturation and release. And also, estrogen is critical in carbohydrates and lipid metabolism. You see, PCOS is just a constellation of many things. Symptoms of PCOS. Number 1, no or scanty or heavy menstrual flow. Number 2, lack of ovulation. And of course, if you don't ovulate, you cannot take in. So PCOS is a leading cause of infertility. Number 3 is miscarriage. 4, acne. 5, belly fat, or what some people refer to as pot belly. PCOS can also have some psychological effects like poor self-image, anxiety, and depression. Laboratory indications of PCOS. Number 1 is an ultrasound scan revealing multiple cysts on the ovary. Number 2 is high testosterone level. 3 is high LH and FSH ratio. In a normal woman, LH and FSH ratio should be less than 2, but in women with PCOS, it's usually greater than 2 or 3. Number 3 is impaired glucose tolerance seen in oral glucose tolerance test. Number 4 is high insulin level. Number 5, high triglyceride greater than 150 milligram per dl. The last but not the least is high waist circumference. And you can check your waist circumference yourself. Risk factors of PCOS. Family history of PCOS. If your mom or sister has PCOS, it's more likely that you will have it. Secondly is obesity. Obesity causes PCOS, and PCOS, on the other hand, causes obesity. Why do you need to reverse PCOS? PCOS is not only an infertility issue, it is also a metabolic disease, a metabolic condition that can metamorphosize into very serious conditions like diabetes, endometrial cancer, ovarian cancer, and breast cancer. All these organs that requires estrogen to function well can become cancerous in the future. The big one is that it can predispose you to cardiovascular diseases like stroke, heart attack, heart failure, and the rest of them because estrogen protects the heart. That's the advantage women have over men in reproductive age. But once a woman becomes menopausal, she loses that advantage. How do you reverse PCOS? It's not a death sentence. No, you can reverse PCOS through lifestyle modifications. Number 1 is having good sleep. Good sleep is having at least 8 hours of sleep daily. And to have a proper sleep, you need to shut down your exposure to radioactive elements 2 hours before you sleep. And radioactive devices, that's devices that emit rays, your phone is number 1, the television is the second one, on other things that emit rays. You need to shut down 2 hours before you sleep and get at least 8 hours of sleep. Number 2 is eating balanced meal with low carbohydrate. Carbohydrate is the main thing that stimulates the production of insulin. So you need to cut down on carbohydrates and eat food that contains low carbohydrate, that contains low glycemic index carbohydrates. I'm going to elaborate on this in my next video on insulin resistance. Number 3 is exercise. Exercising helps your tissue to take in glucose without the help of insulin. So exercise is very, very important for PCOS women. Number 4 is avoid smoking. Both primary and secondary smoking should be avoided. I know these things, they're easier said than done, I know. But I got you. There are things that can help you win. And the most important factor that will help you win is staying disciplined and consistent. But you cannot stay disciplined and consistent without good systems. So you need to install good systems that will help you stay both disciplined. What are the systems you can install? Number 1 is having weekly meal plan, planning your meals ahead of time. Number 2 is having sleep routine, a time for sleeping and a time for waking up. It also helps your brain in some ways. Number 3 is stacking the new habits you need to imbibe into already existing habits or already established habits. For instance, you can decide to exercise after your morning prayers. You can decide to exercise before you sleep at night, before you do your night routine. So these things will go a long way in helping you establish a new routine that will help you stay consistent and disciplined and win PCOS. Do subscribe and share it with women in your circle, even men in your circle, because they have women in their circle. So share it so women who need this can get to see it.